Andrew Harrel. I'm a student doctor at SCU. And what was your name?
Jamie Lockway.
All right, hello, Mrs. Lockway. How are you doing today?
I'm pretty good. And you?
I'm doing well, thank you. So, what exactly brings you in today?
My left ankle.
Okay, so you're having problems with your left ankle?
Yes.
Okay, and can you point out or tell me exactly what side it's on or where you feel the pain
It's
the
right
most?
here on the left side where the right here.
Okay, so it's like you'd say on the lateral side?
Yes.
Okay. Lateral ankle. Okay. And how long ago did this happen?
About 6 months ago.
6 months ago. Okay. And then can you recall what you were doing when this occurred?
You mean how it happened, or?
Yeah, like how it happened, or do you remember what you were doing?
I was jogging.
Okay.
And it just caught me.
Okay, you're jogging and just you kind of got a caught feeling. Okay. And how would you say this is affecting your active daily living?
Well, now it hurts to walk.
Okay, so now you're having problems, hurts to walk. Have you gone to see anybody else about this?
I did about the third month of physical therapist.
Okay, so you went to physical therapy the third month.
Yeah.
And is there anything that makes it worse?
Overdoing it.
Overdoing.
Like overwalking or exercise.
Okay. And what about better?
Icing it.
Icing. Okay. And have you had any prior injuries to this ankle before?
Yes, when I was about 40 years ago, I was in a car accident, broke my ankle.
Okay. Car accident. You broke that same left ankle?
Yeah.
Okay.
Yes.
And since this injury has occurred, has it progressively gotten worse, or would you say it's progressively gotten better? Or stayed the same?
It's kind of stayed the same.
Okay, stayed the same. Now, what's the quality of your pain? In quality, I mean, is it a sharp pain? Is it a dull pain? Is it feel like someone's stabbing you?
The best way I could describe it, it's just a constant dull pain.
Constant dull pain. Constant dull. All right. And does this pain radiate anywhere? Meaning radiation, do you feel it coming up your leg? Does the pain just stay in the ankle?
Oh yeah, it goes up my leg.
Okay, so how far up your leg would you say?
Right below my knee.
Okay. So you can sometimes feel it a little bit higher?
Right, when I'm especially when I'm walking.
Okay, so you feel it radiates when you're walking?
Yeah.
Okay.
Not when I'm sitting still.
Okay. So the severity of the pain, I'm going to give you numbers between 1 and 10, 1 being little to no pain and 10 being the most excruciating pain you've ever felt. What would you rate this pain right now?
Probably about 6, 7.
So right now it's about a 6 or 7?
Yes.
Okay, so what at its worst, what is it?
Probably 8, 9.
Okay, and then at its best, what would you say?
Since this occurred, probably about a 5.
A 5. Okay, so you're always constantly having some pain there.
Yes. Okay. It's like this dull, constant pain.
Dull, constant pain. Okay. So how many times a day do you feel this pain every day?
Yes.
Okay, so it's the pains every day, and then how long does this pain last? Is it like I understand you're saying it's constant, but so like from waking up to going to sleep, you're feeling it all day.
Yeah, if I'm walking, I feel it. But yes, there's not a day that goes by that I'm not feeling it.
Okay, all right. So now we're gonna jump into some of your family history. Is that okay?
Yes.
All right. Does your mom and dad have any known chronic illnesses that you were aware of? Diabetes, hypertension, high blood pressure, things like that?
No.
No. Okay. Are you allergic to anything?
Penicillin.
Penicillin. What about you? Is there anything that known for you? High blood pressure, cancer, diabetes, nothing of that nature?
No.
Okay. Are you taking any medications right now?
No.
No. So, I remember you were telling me about the accident that occurred, car accident about 30 or 40 years ago. Is there any other accidents that you know that you're aware of or you'd like to tell me?
No, that I tore my ACL, but that's on the same leg. That was
Okay.
it.
Okay, so you tore your ACL, same leg. And was that a different, that wasn't with
Yes.
the car accident, and you haven't had any pain with this?
Right,
And this ankle injury hasn't caused further pain to your knee?
right.
Okay. So surgery-wise, did you get surgery for your torn ACL?
Yes, I did.
And when was that?
That was 10 years ago.
Okay, and then have you had any surgery for your fractured ankle or anything?
Just
any
at
other
the time of,
surgeries?
at the time of the accident, they put it in a cast.
Okay, so but there was no surgery.
Correct.
Okay, any other surgeries you'd like to tell me about?
No.
Okay, have you ever been hospitalized before?
With my pregnancies.
Okay, pregnancies. Okay. So now I'm gonna jump in and ask you some of your social history.
Okay.
All right, and what's your marital status?
I'm married.
Married. Do you smoke tobacco?
No.
Or do you smoke anything?
No.
Okay. What about alcohol?
Occasionally.
Occasionally. And occasionally would be a couple drinks a week, or what would you
Probably
say?
about, yeah, I'd say four drinks a week.
Okay.
Or something like that. Yeah.
All right. And are you working? What's your occupation?
I'm retired.
Retired. And how would you say your overall diet is?
I eat pretty clean.
Okay, pretty clean.
Yes, I'm a little overweight, but pretty good.
Okay, pretty good. Okay, so now we're going to talk about, I'm going to ask you some questions about your sexual history. I ask all my patients these questions. I understand that sometimes it can be a little bit uncomfortable,
Okay.
but I just want to assure you that these questions are going to help me provide better health care, medical care for you,
Got it.
potentially. Is that okay?
Of course.
All right, so are you sexually active?
Yes.
Yes. And so do you practice safe sex?
I'm 63 years old, so I'm good to go.
Okay. 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 So now I'm going to ask you some general questions, okay? Do you notice any changes in your sleep patterns, or?
Well, I'm a pretty good sleeper.
Okay, pretty good sleeper. Okay. Do you notice any ever night sweats? Do you ever wake up
No,
with sweats? No.
no.
Okay. So, regarding your muscles and like your skeletal system, do you have any like joint swelling or joint pain other than that ankle area that you're aware of?
No, I'm not
No.
aware of it.
Okay. What about stiffness?
No, I'm pretty good. I mean,
Okay.
it takes me a little bit to get up in the mornings, but I'm pretty good.
Okay. Now, for your head, do you ever feel any dizziness?
No.
No. And for your eyes, do you ever have blurry vision?
No.
No. Do you ever have trouble hearing, or?
No.
No. Do you ever have a problem with your smelling?
I have allergies, so I know that it affects my smell sometimes.
Okay. Okay. So your allergies. And do you have any trouble with swallowing?
No.
No
No.
problem. You can taste all your
Yeah.
food and everything.
Yeah.
All right. Well, this looks like this is going to conclude our history taking. I
Okay.
appreciate it. Thank you very much.
Okay, great.
All right.
Thank
have
you.
a good one.
Okay.